A background to this forum, why this forum, is that back in August last year, members of our consumer community of interest told us that you wanted to be involved in the decision-making and the messaging around COVID-19 vaccinations. And we fed your suggestions up to the department. Engagement around the vaccine rollout has been happening with the department since late last year, primarily with consumer and community organisations such as Health Consumers Queensland and the Refugee Health Network, Queenslanders with Disability and Qd Queensland, other NGOs and a small number of consumer reps. A fortnight ago, we held a consumer conversation, the first of the year, and asked members of our COVID-19 community of interest what you were thinking about the COVID-19 vaccination rollout. And we were able to get a baseline idea of how you were feeling in the lead up to the vaccine rollout, which started yesterday, what information was helping you understand the vaccine and where your information gaps were. And we put together an issues paper, and we'll pop the link to that in the chat so you can see a summary of what was said. But primarily the concerns were around safety, around efficacy. You wanted assurance that principles of equity of access will be followed by all health services delivering the vaccines. And this was a theme, this has been a theme throughout the pandemic. You also want individualised information that lets you know about the safety of the vaccine for you. So, without further ado, I'd like to introduce Dr. Young, and I'd like to start by saying that never before has our health system, our society, our economy, our lives been in such collective upheaval for so long. And we believe that here in Queensland, our safety has been ensured to one of the highest levels of the world through this pandemic, through being highly responsive. Rapid policy decisions based on public health evidence, and Queenslanders who have embraced these principles and responded by altering how we live, including making many sacrifices for the greater good. We acknowledge and thank Dr. Young for the role that she has played in leading Queensland's pandemic response, and we're very grateful to her for coming along this evening, presenting to you and answering your questions. So Dr. Young, I'll hand over to you.
Thank you very much, Melissa. And you're absolutely right. This has been a response that every single person in Queensland's participated in just brilliantly. And that's got us to where we are. So now we need every single Queenslander who's comfortable and happy to and able to be vaccinated so we can get ourselves out of this. And I'm positive that it will happen. So thank you. First, I would like to acknowledge the traditional owners of the land upon which I'm sitting here, the Turrbal and Yagara people, and pay my respects to their elders past, present and emerging. And I'd also like to comment how brilliantly our First Nations leaders have responded to not have a single outbreak in any one of our discrete First Nations communities in Queensland of COVID-19 is unbelievable. And so we are going to be able to get vaccine into those communities before the virus gets in, which is the perfect outcome. So that's been wonderful. So thank you very much, Melissa, for your invitation. And I see Erin up there. Thank you very much, Erin, as Chair of Health Consumers Queensland. It's been so fortunate that we've had Health Consumers Queensland in place, so we didn't have to create something, because we would have needed to. If you hadn't have been in place, I would have said day one we needed something. We already had it. So that's why Queensland's just done so well. We've had so many things in place ahead of the pandemic. And that's the only way to do things. It's been brilliant. So what I am going to do is take us through a whole lot of information. There is so much information, so it will take a while to get through, and it will be confusing. So hopefully you'll, and there's already, I see 54 comments in the chat line, which is great. Hopefully people will then put questions in the chat line that after I've gone through the information, because there's going to be enough time, that I can then go through, and I'm very happy to repeat things and go through things because it is extremely confusing. It shouldn't be, but it is, and I think the more information that everyone can get, the better, because it is really, really important that people like you understand this so that you can go out to all the different groups throughout Queensland and explain it. That's so important, because my hope is that every single adult who's able to be vaccinated in Queensland chooses to come forward and get vaccinated because they've had the information to assure themselves that this is a safe, good thing to do. So as you know, this vaccine has not been mandated in Australia. Having said that, though, we need as many people as possible to get vaccinated so we can get ourselves out of this and move back to a normal life. So thank you very much. As the leaders you are, the representatives, the consumers, you are from such a diverse range of backgrounds, wanting to spend this evening, this is your time, wanting to come forward and hear about what hopefully will then give you the understanding to go out and explain to people. I'm really grateful that you're all prepared to do this. And I'm also grateful the role you've had right from the start, because truly the response here from people across Queensland has been astronomical, unbelievable. And I've just got to tell you this story. When I went out beginning of January, when we had that first case of the UK variant in one of our hotels get into the community, I was really worried about it. And then we, locked down Brisbane, and I just couldn't believe it. I was driving back from William Street, where we had the press conference with the Premier, to my office in Charlotte Street, and everyone had a mask on. I went, how did they hear that so quickly? And people just did what was necessary. We got ourselves through it, and it was just perfect. So that's just amazing how people have just engaged, and so much of that will have been due to what Health Consumers Queensland has achieved across the state. So a well-informed community is a community that's ready to act and to respond. So thank you. So we've started, as you know, our first vaccination clinic at the Gold Coast on Monday, and they did. I challenged them with a target of 100, which was a pretty nifty challenge for something that was brand new to get sorted, and they did 203. So there we are. And then today, I'm going to check this number because I still don't believe it, they did 322. And they think there might be a few more because I just met with them just before this, this Zoom meeting. So they're out there, they're going. So that's fantastic. And then we'll have more Pfizer hubs coming online over the next 2 weeks, which is good. So the first phase of our vaccine program will include 125,000 people here in Queensland. 37,000 of them Queensland Health will be vaccinating, and they're the people who make sense. They're the people I'm really worried about that could get COVID and then go and spread it in the community. So they're at the international border, they're working in our quarantine hotels, and they're working in our hospitals looking after confirmed cases. So they're the group that I think is just so critical to get vaccinated, that 37,000. And once they're vaccinated, we can sort of half a sigh of relief, because we'll have then done everything we can to prevent COVID coming in, because the only way COVID-19 is going to come into Queensland is through the border. We don't have community transmission. I'm very, very confident in saying that. And actually, I don't think there's anywhere in Australia that's got community transmission today. So if we can sort out our borders, we're home and hose. Then the second group that isn't actually as urgent, if we get the first group sorted and done, is the most vulnerable. So they're those 88,000 people who live in one of the aged care facilities or one of our disability accommodation facilities, and the staff who work in those facilities. So the Commonwealth has started them, and they've started with 41 facilities scattered across the state, and they'll continue that. That's their role. Now, all of that, our 37,000 and the Commonwealth's 88,000, they're doing public and private facilities, will take around 4 to 6 weeks. And that's where we're focused at the moment. And it's, I think, just astounding that we've reached this stage just over a year since we had our first cases here in Queensland at the end of January at the Gold Coast. So you can see that's why we decided that the Gold Coast would go first. They had the first cases, so they should have the first vaccine. So that's just been astounding what's been achieved. But I know, so I'm going to labour this point, that there are some people a bit concerned that this has happened so quickly. I can just assure people, though, the reason it's happened so quickly is that all the world's resources, both intellectual and financial, have just been focused on one aim, and that's to get a vaccine. Yes, there was some work done on treatments and some other things, but essentially the one aim from the world scientific community and the world's governments has been to get a vaccine. So instead of the usual process for developing a vaccine, which is you do the first stage, everything's right, then you go and put in for grants, and the grants usually happen once a year. So you go and get money, and then you do the next stage. You get through that, then you work it all out, then you go and put in for another grant. You get some more money, and it takes 10 years. And that's mainly because of the time taken to go and get the money to do the next stage. This time, governments committed all the money up front so that they could just start and keep going without having to stop and start. And also, the researchers didn't do them sequentially. They did them concurrently. So they started the first phase and immediately, as soon as they had some reassuring data, started the next phase and then the next one. So it concertinaed everything, but no step was missed. So all of the information that was needed from each phase got to the regulators, and they had all of the usual information to make their decisions on. And then we all know that the TGA, thank goodness, is the pickiest, most nitpicking organisation in the world. They are just brilliant. They are the regulators you want. And they do it all the time. They know what they're doing, and they've gone and done that. So these vaccines are absolutely safe. There is no doubt about that. Then the other thing I wanted to mention, because it's already started happening, which I think is just awful. There are some people in this world who I really would love to get cranky with, and that's the scammers. They're already out there scamming people about vaccines. So my advice to you all to spread out to people is that if someone asks you for money related to the vaccine, you know it's a scam, because every single vaccine will be given in Australia free to anyone who's on our soils, whether they be refugees, homeless, people without Medicare cards for whatever reason. Everyone can get vaccinated and it's free. No cost at all, no additional costs. Our GPs have been absolutely brilliant. They've all agreed that they will do this for the costs that the Commonwealth is giving them to do it. There'll be no additional costs. Although someone did raise the cost of parking. I hadn't thought of that one. So yes, people do have to pay for parking if they're going to one of our hospitals. But that I don't see as a cost associated with the vaccine. I hope that's all right. And the usual parking, benefits for vulnerable people, etc., apply. So those usual processes. But I just think if we could get that message out, if someone's asking you for money, it's a scam. So that's really important. Then I also want to reassure people, yes, I know there's only 6 Pfizer hubs in these first 2 weeks, but as soon as we get the AstraZeneca vaccine, which I understand is not that far off because CSL has started already rolling out files off their production line, it won't be long, and we're also expecting some from Europe fairly soon. As soon as we've got the AstraZeneca vaccine, it can go anywhere and everywhere because it just needs the same storage requirements, etc., as any of the normal vaccines that we're used to, flu and all the others. So it will get out to every nook and cranny of the state. So although people in those more remote areas are going to have to wait, it won't be for long. So just to reassure people there. Then the next point, and I said this early on, this vaccine will not be mandated. So the Prime Minister has made that absolutely clear. I do hope that every single adult is able to get it, has it, but that's through choice, not through mandating. And we know that the vast majority of people choose to get vaccinated. More than 95% of our kids get vaccinated in Queensland and throughout the country. So I'm not particularly concerned, but I do want to go out and give information to everyone. So I don't want anyone out there thinking, should I or shouldn't I, because I don't understand it. So the idea is to get information out everywhere. Now, eventually, I'm sure there's going to be some discussion about consideration of mandating the vaccine in certain places, such as aged care. That will be worked through about how that may or may not happen. And it's not going to happen until there's enough vaccine out there for everyone to be able to have been vaccinated. So, but at this point in time, there is no decision anywhere to mandate the vaccine. But going forward, I'm sure there's going to be some discussions about it in some of those most vulnerable areas, but it'll be a national decision, won't be a state decision. Now, it's a massive rollout we've committed to, but I know we're up to it. Just to give you a bit of context, in a normal flu season, we would distribute around 1.8 million flu vaccines over 2 months at the start of the flu season. That's into arms. That's not just distributing to fridges, that's into people. So I'm sure that we'll be able to get 8 million doses out to the 4 million Queenslanders who need it, the adults, in 6 months. I'm not concerned. We've put our best minds to it. We've got our best people involved, and we'll roll this vaccine out. So, oh, and the last point, of course, that although we've got the vaccine rolling out, nothing's going to change tomorrow. We're going to have to get a large number of people vaccinated. So we are going to have to maintain all those things everyone's got so good at. So the physical distancing, you know, being practicing good hygiene, washing hands, and most important of all, staying home if you're sick. I hope that continues forevermore, because it will not only work for COVID, but for flu and for so many other things. So it's just important. We've just got to change that awful ad about soldiering on, you know, with whatever drug someone wants to promote. We just got to get out of that. People just need to stay home. And now, for a lot of people, you can stay home and keep working. If you're only mildly unwell, you can Zoom it, you can, yep, you can do it from home. So I think that it is really important. We've seen the amount of sick leave just plummet during this pandemic. So that's a really good thing. So we've got to keep that going. And then before I go on to some really specific discussion about various very important issues, the last thing I wanted to say here was it's so important if all of you can get out and really just reinforce a couple of key messages. First, that the vaccine is absolutely safe. It's gone through all the rigorous testing. Secondly, it's free and there is no cost. So anyone who asks you for money, you've got to think that's a scam. And third, it is voluntary. People are to choose whether or not they want to have it for themselves and their kids and people they're making decisions for. So they're the three key points that I'll repeat many times as we go through the evening. Now, some specific things I thought important to go through. So the first one, I think I've gone through, but I'll go through quickly again, is about the vaccine safety and the fact that the TGA has got such a long track record in Australia of reviewing any new medications, any new vaccines, and going through them. So people should be reassured that they'll only approve a vaccine, and they've given full provisional authorisation for vaccine, not like other countries that have given emergency authorisation. They've given the full provisional authorisation, which means for 2 years. They'll continue to require, as with any new drug or vaccine, and indeed any vaccine going forward, they'll require that people notify them of any instances of adverse events, and they'll investigate all of those, because just, I mean, we're rolling this out to so many people. There will be, through coincidence alone, instances of adverse events. You would have seen that in Norway, there were 33 people who unfortunately died soon after receiving the vaccine, but normally they would expect 400 deaths like that in that cohort in a week. So it was just that Norway made the decision, which I totally support, and I would think we will do the same here, that everyone would get vaccinated, no matter how old or close to death or vulnerable they were, they would get vaccinated, because you don't know when someone's going to die, and they mightn't have, and they might have then got COVID, and what an awful way to die when a vaccine was there available. So they made that decision. 33 people did. It was thoroughly looked into. The TGA here looked into all of that data, and it was clear it was pure coincidence. So that's what the TGA will continue to do as this vaccine is rolled out. They'll look at every single adverse event to work out if there's any issue. We're sort of a lot further down the track even than when the TGA was looking at their data, because now there's been many, many, many millions of people who have received these vaccines overseas, and we've been getting all of that ongoing data. So that will continue as we go forward. And it's really important, if when you're talking to the different groups you engage with, that people let us know about any adverse events. We know there are going to be some mild ones that will always occur with every vaccine, you know, a sore arm, maybe a headache, some fever. People could feel a little unwell. We know that they resolve very quickly, but we should still know about them. It's good to know about anything. So people should come forward. So that's about safety. Then effectiveness. There's been a lot of debate out there about which of our first two vaccines is the more effective. And I can't work it out. And I've certainly been looking very thoroughly at both. So the Pfizer vaccine and the AstraZeneca vaccine. And when it comes down to it, it's more important you just take the first one that's offered. That's what I'll be doing. Whichever one gets offered to me, when my turn comes up, I'll be taking. Because down the track, we know there are going to be more vaccines, and we know that they'll cover some of these newer variants. So the initial ones mightn't cover everything, but there'll be more. Now, the first two vaccines you get need to be the same. So if you get Pfizer, then the second dose needs to be Pfizer. AstraZeneca, the second dose needs to be AstraZeneca. That's not the case for the third. So when we look at rolling out, as we do with flu, we roll out a new flu vaccine each year. When we look at rolling out another vaccine for COVID-19, which I expect we will be, then there's no problem with whichever vaccine you had first. You can just have the next one, whichever one is around then. So people should just take the first vaccine they're offered, not wait for maybe a better vaccine, because I think these vaccines are just brilliant. These are amazing, but I'm told that there might be even better ones. We know that that's usually the case as more get developed, and then there's more time. But the two that we have here in Australia that we're rolling out today and very shortly are both extremely safe, equally safe, and both very, very effective. There's some suggestion that the AstraZeneca might stop transmission, but then the Pfizer one didn't measure that. So who knows? They're both really good vaccines. Just have either of them. The only difficulty with, if I can say it's a difficult, with the Pfizer one is it needs that cold chain storage at -70 degrees Celsius, which makes it a difficult vaccine for remote populations. But in terms of which one to have, both great. Then another thing it's been suggested I raise with people is the difference between vaccination and treating someone, medication for the disease. So a vaccine is there to prevent you getting serious disease. It won't necessarily prevent you getting infected. We know that, but it will prevent you getting severe disease and dying. And that's what we want from a vaccine. Although it does mean that it's really important that everyone gets vaccinated to protect themselves, because we know that if people can still get it, they can, as I mentioned a bit briefly just then, they can still transmit it. Although the suspicion is that we won't get those super spreader events where one person spread to 40 people, because if you've been vaccinated, then your viral load is going to be so much less. Therefore, the risk of being a super spreader is so much less. But people still could spread to maybe one other person. And if you've not been vaccinated, you'll be that one other person. So that's what the vaccine will do. It will stop you getting severe infection and dying. Now, medications can be used to treat people once they've got an infection and are very ill, but we don't have any good medications yet. We've got dexamethasone, a steroid, which reduces the risk of you dying. Instead of 6 out of 6 people dying who are going to die, only 5 out of the 6 will die. But there's still 5 out of the 6. So I think you're far better off to have the vaccine that is means that you're much less likely to die from getting it. So that's the difference between a vaccine and a medication. It's easy to confuse the two. All the world's resources really went into developing a vaccination. There's still a lot of work being done to look at medications, but that'll take a bit longer before that all gets sorted. So, so that's really important that people just understand all of that. So there's a lot of discussion about herd immunity and the aim for that. Well, I think it's probably more important for this disease and this vaccine that everyone just get vaccinated who possibly can, rather than relying on enough people having been vaccinated so it won't spread. Particularly as we're going to be vaccinating adults first, and we know children can get this and spread it, but it's very, very, very unlikely that a child will get it and become seriously ill. That's why we're starting with adults. Also, the research has not been done, the clinical trials have not yet been done on children to ensure its safety in children. Now, it's highly likely to be safe in children, but given they're not the high-risk vulnerable group, it's adults, that's why we're starting with adults. But children could still get it and spread it, which is why adults have just got to get vaccinated. Okay. Now, the next issue I want to go through before I deal with some of those 94 chat comments. I hope someone's going through them all so you can ask me the questions, because I haven't been keeping notice of them as I've been going through, but I'll get to them. So the distribution of the vaccine, as I said, with the Pfizer vaccine, it's hard to distribute because it's got to be maintained at -70 degrees Celsius, which is hard. It means a lot of dry ice, a lot of freezers, and a lot of processes of monitoring them. Because if it gets above that temperature, then you've got to really quickly use it. So it can stay above that because it's got to eventually, of course, be thawed to go into someone's arm. It's not cold when it goes into someone's arm. So if it does accidentally get thawed during its journey to wherever it's going, it's just got to be used really, really quickly. So that's why it's not a good vaccine for most of Queensland. But we get there. We're pretty good at distributing vaccine. Now, the Commonwealth Government is responsible for getting vaccine to where it's going to be administered, and you've already seen that. We've had that first 2 plane loads come into Brisbane Airport and Cairns Airport last Sunday, which was really exciting. And then they're getting vaccine out to those initially 41 aged care, disability care facilities, and they'll continue that process. So all of that's great. So we'll start all of that. I just don't want to repeat stuff, so there's time for the questions. So once we've got that AstraZeneca vaccine, we will be working very, very quickly and closely with GPs, pharmacies, and all of our Aboriginal community health services to make sure they've got vaccine and that they can then roll it out, because we know they're really, really good at vaccinating. They do it every year for flu, and we know that they'll be able to do it once they've got the AstraZeneca vaccine. It's not fair to ask them to go and do the Pfizer, because we just don't have enough fridges. I mean, that you can imagine that's where one of the shortages is. We've got enough fridges here in Queensland for our hubs, but there just aren't enough to get them out to everyone. So then also online, you would have seen, I'm sure a lot of you, that there's so much material out there that we've worked through to make sure it's as accessible as possible through the Commonwealth website and through the state government website. So all of that's there, and there's a whole lot of websites and phone numbers that people can call. So then I just wanted to end again with my key message that the vaccine is safe, it's effective, and it's voluntary. That's the three key messages. But then to make sure that it gets out and as many people take it up as possible, we've got to get the information out there. So thank you very much. We're up to 99 plus in the chat now, so go for it.
Excellent. Thanks, Dr. Young. So we've been furiously copying and pasting and organising. So hopefully we'll get through as many as possible as we can. Let me just scroll up. So thank you so much for that comprehensive overview. I'd like to go back to a question around overview of rollout and access and go to Hayden R to ask his question about access. Hayden, can you pop your microphone on? You with us, Hayden?
Probably before I do that, maybe if I go through the phases. I just realised I didn't go through that in detail. It might help. So phase 1A is the first 125,000 Queenslanders, the 37,000 high-risk border workers, quarantine healthcare workers, and the 88,000 in disability care and aged care, and the staff who work in those. So that's what we're rolling out from Monday across those 6 hubs. Then as soon as we've done those 125,000, which will take us probably 4 to 6 weeks, we'll rapidly move into what phase 1B, which is 1.049 million Queenslanders. And that is adults 70 years of age or over. It is the remaining healthcare workers that weren't done in 1A. So 1A is ICU, emergency department, COVID wards in the public sector, because that's where the cases are being treated. So then our remaining healthcare workers in public and private will get done in phase 1B. Any First Nations people over the age of 55, then any younger adults under 70 or under 55 for First Nations who have serious medical conditions, comorbidities, and that includes those who have a disability that weren't caught up in 1A. Plus then the last group is critical and high risk workers. So that's police, fire, emergency services, defence. Plus one group that sounds a bit odd, but it makes sense when I explain it, meat processing workers. I don't know if you remember, but Victoria had quite a few outbreaks and it just went like wildfire through meat processing workers because of the environment they work in. So we're going to do them in phase 1B. So because these are nationally agreed phases that the whole country is following. Then in phase 2A, which will probably start May, June, depending, it all depends on how much vaccine we get, because we know the supply chain from overseas is a little bit iffy. So it'll really depend on CSL, and they've said they should be able to get 1 million doses per week from the end of March. So as long as all of that continues, then we should, May, June, be able to get to phase 2A, which is 1.25 million Queenslanders. And that will be adults who are 50 years of age or older, First Nations people who are 18 years of age or older, and any critical and high-risk workers that weren't picked up in phase 1B. So that'll be phase 2A. And then we'll get to phase 2B, which will be probably July, August, which is 1.496 million Queenslanders. And that's the balance of our adult population. So that's all of those people 18 years of over who don't fit earlier. They'll be done then. Then phase 3. So phase 3, which is kids under age 18, 1.177 million of them. They'll be done depending on the results of clinical trials, because they haven't been done to date. They've been done for 16 years plus for Pfizer, but no kids were tested with AstraZeneca. So it'll depend on clinical trial results. It'll depend on the TGA assessing those clinical trial results as they've done. And it'll also depend on whether that is the advice, that that's the group that we do. So they'll be phase 3 if it happens. Now, if there's a decision to vaccinate kids, they're really easy to vaccinate. That's what we're really good at. You know, over 95% of kids 5 years and under have had all their vaccines. Then we have all the school-based programs. So it'll be easy to do them. So we're not worried. We'll just tack them on at the end. So the plan is to have finished phase 2B by the end of October. There might be some people who still need to get their second dose of AstraZeneca, because Pfizer, you need 21 days apart. AstraZeneca, the best result is if you're 12 weeks apart. So there might be some people still needing that second dose, but we certainly hope that everyone will have had their first dose well and truly by the end of October. So that's the plan. Now, the only group that we're suggesting some caution are pregnant women and people planning pregnancy, and then also people who are mums who are breastfeeding. The reason being that, again, the trials didn't include them because they don't. Trials never include pregnant and breastfeeding mums because you want to test it out on other people first before you go and risk sort of 2 lives, if that makes sense. But there were a lot of women who got vaccinated in the UK who then subsequently got pregnant, and there were no signals of any problems whatsoever. And it's not live virus, so therefore it should all be absolutely fine. But at this point in time, the advice is that for those women, that they just speak to their treating clinician about what is best for them. If they're in a really high risk group, then I think most treating clinicians will say, look, the risk is minuscule, if any, so get vaccinated because you've had a transplant and you're at really high risk, or if you've had something else. So that we're saying at the moment, until there's more advice from the TGA and from ATAGI, who are the experts in advising about vaccination, we're just suggesting for that group that they go and get some specific advice. For everyone else, they should be right to go. So now, have we sorted out that question that Hamish it was, wasn't it, who wanted to ask?
So, Jeanette, what I might do is condense. We've got about 4 questions that are on the same issue that Hayden was going to ask about. So I'll condense them into one. And it follows on from you talking about the rollout stages. So can you speak to how health services know who is on that list? Hayden says, for many of us, him included, do not have a My Health record with the federal government site. I'm only his GP and HHS consultant, who he sees once every 6 months. Candice says, how will she know what phase the government has decided to put her in? And Candice has also asked, will we get a letter in the mail? And how do you know when it's your chance to get a vaccine? Stepping back from that, Matthew Ames actually asks, who determines whether a condition qualifies for, say, phase 1B? Would you mind answering those questions?
Certainly. So whether a condition qualifies or not is the same as the flu vaccine. So we're using, wherever possible, the things people are used to. So it'll be the same sort of process to work through. So there are some very specific, I can take you through. I probably need to read it. So who's getting, she should just, possibly the easiest way is that people who have a doctor that they're going to, because they've got chronic disease, whether it be diabetes, severe illnesses, then that doctor can advise them that they're going to be in whichever phase. Now, probably the most important phase is the first one, because that's the one when we've got the severe constraint on supply. We just don't have the vaccine, so we need to really tighten it. And we have gone out to those 37,000 people and they have been told, so they know they're in that group. It's a very constrained group. In some ways, people will know they're on it because they're getting tested daily for COVID-19, or for some of them it's weekly. So they'll know they're in that group themselves, and we're going out and calling them in. And then the Commonwealth is going into those aged care and disability care services, accommodation. They're actually physically going in. So those people don't need to do anything. They'll be there vaccinating the staff and the residents in those facilities. So phase 1A, no one needs to do anything. We'll be pulling you in to get vaccinated and to work with you to get your consent to do it and to get you there. So that's all happening. Then at the moment, we are working through with a whole lot of data from the Commonwealth and from our Electoral Commission and from our own data in Queensland Health and from a whole lot of other data points to get all of the data for the people who are 70 years of age and over, for the people who have got underlying medical conditions. So, and all of the healthcare workers, we're working with APRA data and all sorts of things to get that information out there. But we'll also be messaging, just because you've then, if for some reason you've not contacted and you think you're in that phase, for people to come forward. But we'll have more vaccine, so we'll be able to do that. And that's already 1.049 million people. So we'll just be working that through. Where we've got workforces involved, we'll be going to them and working with them. So police and Defence Force and emergency services, so those ones. Then it'll get more complicated. But I'm very, very confident that we'll have the vaccine rolled out to GPs and to the Aboriginal controlled medical services and to pharmacies for phase 2A. So people have lots of options where they can go online and just book appointments and turn up. So that will be much easier. So that's the 50 years over and over, and the First Nations people, that'll be a much easier process. And that we deal with every single year with flu. If you think about it, we have those criteria and it's managed very, very well. The people who are vaccinating know what their criteria are and will work with people to vaccinate them. And as I say, it works each year, and we'll have plenty of vaccine by that stage. So there won't be the same absolute imperative that we have to narrow it down so tightly. And then we'll rapidly move into that last 1.5 million to vaccinate there. So it will work through. People can go online, so all of that information is online to very specifically go into, and I see Hayden's just put up a website that's brilliant, that people will be able to work out themselves which phase they sit in. But the thing to remember is if we get our job right, which I know we will, and get those first 37,000 vaccinated, we have essentially will have mitigated the risk for everyone. So if we stop the vaccine being able to get from our international borders and our quarantine hotels and our hospitals, then it won't be out in the community to infect people. So that's the important thing. So we're not going to remove those international border restrictions and those quarantine hotels until people are vaccinated and safe. So that'll be towards the end of the year when we'll start initially considering whether that happens. So everyone will have a chance to be vaccinated before that risk happens.
Okay, thanks, Dr. Young. So it sounds like it will be a combination of, and we'll talk about comms and communications and messaging a little bit later, messaging going out so that people can self-identify, but then also proactive communications from health service providers to people who they are caring for to advise them of their eligibility. Yep.
They're pretty standard eligibilities, really. I think people, when you go and look for them yourself, will see, and you can see how they line up with the flu vaccine, which everyone manages beautifully. We don't have problems with people, being vaccinated who shouldn't have been and all sorts of things. It all works. So I'm not concerned. I really genuinely think there's so much goodwill and people have done such a good job to get to this position that I think that people will manage the vaccine, complicated as it is.
Mm-hmm. You mentioned our pharmacies providing the vaccine from phase 2A.
Yeah.
There were a few questions around pharmacy access. So one is seeking assurance that other facilities like pharmacies will still be supporting the priority phases for the vaccine delivery at that stage. So it will be very clear who they're delivering it to, and also the safety around those models. Will they be able to manage anaphylactic responses in a pharmacy setting?
They are brilliant, can I say? So they've now been involved in our flu vaccine program and our broader vaccine program for many years. It was almost as if it was done, and Lisa Nissan, her team and all the people involved initially in the whole rollout of vaccination through pharmacies need gold medals, stars, crowns, everything. They have just it set us up so beautifully. And then day one, when I knew that we were, facing a pandemic, I met with the Pharmacy Guild, with Trent Toomey, and said, right, your job is to be ready so that as many community pharmacies as possible, because not every community pharmacy was vaccinating for flu. And I said, it's really important. I want as many as possible so that we can roll this out, because pharmacies are in the middle of people's communities. They're easy to get to. They've got parking, dare I say it. They're easy, they're great. And pharmacists are so good at following protocols. So they've had years of experience at dealing with this, and now they'll roll it out. So they won't be doing the Pfizer vaccine just because of the cold chain problems, because there just aren't enough freezers to go around. But they will be doing the AstraZeneca. And the vast majority of people are going to get the AstraZeneca vaccine. So we've got 53 million doses lined up of that, and with 50 million of them to be produced by CSL in Victoria. So that's going to sort out our supply chain issues. We're just not quite certain about the supply chain for other vaccines that have got to come in from overseas. We're hopeful, and the Commonwealth's done the best job. They're brilliant. What they've done, getting these vaccines for Australia, is absolutely outstanding. But it is so important that we've got the local. So we've got those 50 million doses that we can count on from CSL. So that will be, as you can imagine, the majority of Australians are going to get that. There are 20 million that the Commonwealth is contracted to get of the Pfizer vaccine, but we just don't know the time frames, how that'll roll out, when we'll get those doses. So it will mainly be AstraZeneca. So that's why it's just perfect for GPs across the state, for pharmacies, and for those Aboriginal controlled health services to roll out that vaccine. And they'll do it well. They all know how to do it. They deal with anaphylaxis. They've had, I don't want to say it to people, but yes, they've had anaphylactic events in their pharmacies, and they manage them beautifully. They're pharmacists. They're the ones that taught me how to manage drugs and what to do. And I can remember having a few anaphylactic reactions when I gave penicillin to patients when I was a junior doctor. And it was the pharmacists that had taught me when to give adrenaline and how, and they just know what they're doing. They're really safe. So I suspect what will happen is people who have a regular GP that they go to that manages their chronic disease, that's where they'll go. And those people who don't have GPs, who are fit, younger cohort, who are well, will go to pharmacies. But people will make choices, and that's really important. And the good thing is they won't be making choices based on cost. They can make choices based on what is best for them as an individual. So if they want to go and get their doctor's advice, that's where they'll be going. So if they don't feel they need that, pharmacy is the place to go. They'll decide.
And speaking of other locations where vaccines will be delivered, there was a question in the chat about whether aged care residents will be transported to Pfizer hubs to receive the Pfizer vaccine there. How will that roll out?
No, the Commonwealth has organised teams to go into each aged care facility and each disability accommodation facility, so that if you've got aged care residents at home, they will need to go to wherever to get their vaccine. As we get down the track, I'm sure there'll be some great models that people will go to people's homes for people who really can't leave their home. But early on, they'll be coming into facilities to get vaccinated.
And we've had a question from Phil Carswell about carers and whether they will be eligible, particularly in caring for people who themselves will be eligible for vaccination as a part of Tier 2.
No, unless they're working in a facility. So if they're an aged care facility or a disability accommodation facility, otherwise the aim is to vaccinate the vulnerable person, not to vaccinate the carer. Because remember, early on, we've only got limited supply. So we've really got to focus where the risks are. And that's for those super vulnerable people, not their carers. It's a very, very sensible question. And as soon as we've got enough vaccine, yes, of course, we want to ring fence around people. But for this vaccine, we know it's actually pretty effective for older people. We're getting that data now. And we didn't have it initially for AstraZeneca, but we're starting to get it. So this is a vaccine that the person who receives the vaccine benefits the most. So that's why, whereas for some other vaccines like flu, we know as you get older and older, it's less effective. So that's why for flu, it's so important to make sure we vaccinate the carers around the vulnerable elderly person. But here we can vaccinate the person themselves. So initially it will be very much focused on the most vulnerable to actually vaccinate them.
And do you know at the moment when carers will be eligible, in which cohort?
That'll be later stages when they reach their key, whether it be age or having chronic disease themselves or being a First Nations person.
Okay. One more question around access. Healthcare workers who provide home care in consumers' homes, and we've had quite a few questions along those lines.
Yep. Anyone who's registered with APRA will be done in 1B. So that's the definition of a healthcare worker. And then rapidly will vaccinate all workers that are critical, and they're critical.
Mm-hmm. On to the question around supporting individual consumers to help make the decision that's right for them. We've received quite a few questions and comments around people who have had adverse reactions. Are there stats to date or a safety profile on those with serious health conditions who have had the COVID vaccine and any kind of adverse events?
Yep, the ones who've had those really severe reactions, those people who have previously had anaphylactic reactions to other medications, to vaccines, or to food or other things. So anyone who's had an anaphylactic reaction to anything else should specifically speak to their treating medical practitioner about what they should do. Now, these vaccines don't have a lot of the same components as a lot of other vaccines, particularly the mRNA ones are quite pure, if I can say that. They don't have a lot of the additives that might have led to reactions to other vaccines. So that's why people shouldn't just assume that they can't have the vaccine. They should go and talk to their treating doctor about what vaccine maybe would be best for them. They're the only group that really there's a significant problem with. So just, you know, people, other than that discussion I said earlier about pregnant women or women planning to have a pregnancy or breastfeeding mums, they're the other ones should have a chat. At the moment, as we get more information, that could all change because we'll find that the risk is even lower. But at the moment, to be ultra cautious, they're the groups that should be a little bit more cautious and go and get some specific advice for them.
Okay, thank you. And that has just answered that same query from multiple people who have had that previous experience. So that's good advice for them to speak to their health professional. Janine asked, what about children who are immune compromised, such as those with chronic health conditions or cancer? Will they be able to access the vaccine if their families choose to do so?
Well, no, it hasn't been tested. So Pfizer has been tested on 16 years and above, so they could go and have a chat. But again, we're not recommending that because we just don't have enough Pfizer vaccine. We're really focused in using that. So for younger children, or for any children under the age of 18, no, not at this stage. The clinical trials haven't been done, so we do need to wait for them. And there are very few children, even children with severe underlying illnesses, who have ended up getting COVID and becoming very sick. The numbers are very small, if any. So really, it's about adults for this particular disease. So we're starting to get the science behind that, and children actually react differently. Their immune system responds differently to the coronavirus, to COVID-19, SARS-CoV-2. So they're starting to get the evidence of why children have done so well in this pandemic. So people at the moment, the answer is no. There are those clinical trials, so that could change down the track. But at the moment, no. This is for 18 years and above.
Thank you. So on to those trials that you just mentioned. Patricia Hall, consumer representative, made the comment that the final phase of vaccine development is usually a long time frame to identify any long-term side effects or unexpected consequences. Given the shortening of the time frame for the COVID vaccines, how can we be sure of the longer-term effects?
Right, so that was part of that post-surveillance assessment that I mentioned very briefly earlier. So that's all being done. You're quite right. there would be usually that long term, but at this point in time, it is more important to save lives. So at this stage, there's been no triggers, no suggestions that there are long-term consequences, and these vaccines have been trialled for many, many, many months now. So we'll keep on looking at that going forward, of course, and the world will continue to look at that. But genuinely, there's been no suggestions that there'll be long-term consequences. We do know that COVID-19, that 10% of people are now suffering long-term consequences, and that's at all age groups. So it is really important that we get this vaccine out to stop people getting COVID-19, and we're also still seeing people dying from it. You would have seen that the United States today tipped over 500,000 people who've died in the last year from COVID-19. So that's what we've got to prevent. And we just can't keep it out forever. We've just seen that no matter how good our hotel systems are, that these new variants will evolve and they are just becoming more contagious. And there's even now the suggestion with the increased information available that some of these variants look like they might even cause more serious disease. So the important thing is that throughout the world, we have to vaccinate as many people as possible so we stop the virus circulating, which stops the risk of more mutations. That's just critical, so we don't get more variants, because this is just such a tricky virus. It's just not playing by any rule book.
Well, speaking of, I feel like you must have the link to our script, Dr. Young. My next question is on the variants. How will Queensland's vaccine program be responsive and protect against the new and future strains?
Yeah, so we're rolling this vaccine out, and that's why it's so important everyone gets it as quickly as possible. We'll roll that out. Then we know that already there are trials happening for the new variants. So once those, and they'll be much quicker to go through the regulatory process because they've already gone through once. So then for the tweaks that need to happen to the vaccines that have already been approved, the regulatory process is much quicker because it's just a tweak. So then we'll be able to roll out those vaccines when they're available. And most likely, I can't promise this, but most likely the evidence is that you only need one dose of those new vaccines when they roll out. So we'll be able to do that much more quickly. And then we'll be able to get on top of the variants, and the whole world needs to do that. And our government and other governments have put money into a vaccine fund for the poorer nations so that they'll be able to vaccinate, which is really, really important. And the Commonwealth government bought a lot more vaccine than was needed for Australia's population. So they've already said they'll be providing that vaccine to our neighbours, to Pacific Islands that can't afford to do it, because that's really important, so they can be vaccinated. So this is a joint effort across the world to get vaccine rolled out, because we need to do that to stop the development of more and more variants. And we just have to get quicker, and we will. So that's where we'll be. But look, we're good at rolling out vaccines. We're good at doing it each year for flu. We can do it for new variants. Once we've got on top of them, the advice so far, and the evidence so far, is this vaccine lasts, it's efficacious for much longer than flu vaccines are. So flu vaccines are really only at the peak of their efficaciousness, if I can say it like that, effectiveness, for 3 months, and after then they start to slowly decline. Whereas this vaccine 6 months later looks really good. So the suggestion is that once we've sorted out the variants issue, people possibly don't need to be vaccinated except for every, several years. And then the other really exciting thing is that they're already doing trials to combine flu vaccine and COVID vaccine in the one dose. So that'll be great if you can just have the one. And then for some people who don't need to be vaccinated against flu every year because they're not vulnerable and they don't think they need to be vaccinated, they could just have one every couple of years that covers COVID and flu. And then people who need the flu vaccine every year because they're so vulnerable could have it every year. So all of those things are being worked through as we speak. So they'll all get sorted and we'll be able to do them. There's no risk. We know how to manage rolling out vaccines, and we've got our pharmacists as well. So that's a strategy. This will help us with capacity. So we've got GPs who are really, really, really good at doing this and do it so well. And then we've got additional capacity with our pharmacists.
So speaking of flu, could you speak to, we don't have those studies yet, but what you're recommending, say, for the next 12 months for people around the timing of the COVID vaccine and the flu vaccine? And is there anything else that we should be doing as a community to prevent a wave of flu happening at the same time as our GPs are reticent to see respiratory illness in their GP clinics and the winter flu season pending?
A really good question. Thank you for reminding me. I should have addressed it earlier. Really, really good. So we need, at the moment, the advice is, and it's been very cautionary, the advice is you need 2 weeks, 14 days between any of the COVID vaccines and a flu vaccine. So if you have the COVID vaccine, then you need to wait 14 days before the flu vaccine, and then another 14 days before having your next COVID vaccine. Or if you have the flu vaccine first, you've got to wait 14 days before you can have your COVID vaccine. Now, the advice probably is if you get offered at the moment this year, if you get offered a COVID vaccine, have that first, have it. And then if you're getting the Pfizer, have the second Pfizer 21 days later, and then have the flu vaccine 2 weeks after that. So, because I'm not too concerned. I don't think we'll have a big flu season this winter coming up because our international borders are still closed, and that's where flu really comes into Australia. So I think it's more important that people go and have the COVID vaccine and then follow with the flu vaccine. If you're having the AstraZeneca, of course, you can have the first dose, then have your flu vaccine 2 weeks later, and then have your AstraZeneca 12 weeks or 10 weeks after the flu or 12 weeks after the AstraZeneca. So you just have to work out which one you're getting and when to slot the flu vaccine in. Now, it's really important, again, that everyone has the flu vaccine because we don't want to have the risk that if we were to have an outbreak of COVID-19, which I desperately hope we don't, but we can't ever say never until we've got everyone vaccinated and we've got variants and everything under control. So it's important because if you get the flu and COVID-19 at the same time, you've got 6 times the chance of dying than if you just had one of them. So we know that the two together is pretty helpful. So let's protect everyone against getting flu, because we can't protect everyone yet against COVID. That's a little bit of a while to come. So it's really important everyone gets flu vaccine when it's available this year, as everyone did last year. People did so well last year. So let's do it again this year. And then next year, we'll have to work out whether people can have them together or they've got to be separated, etc., etc. We'll have more information from the UK, because the UK only had 7 days separation between COVID and flu vaccine. So we'll be able to see whether there were any issues there.
Great. Just to check, all of those timeframes, GPs will have that information about the rollout of the flu, so people can go and clarify that with their GP. And there was all this, yeah.
Sorry, remember our GPs are brilliant at vaccinating. I don't know how they manage our childhood schedule. It is the most complicated vaccine schedule possible. It is unbelievably complicated. And our GPs manage it all day, every day, beautifully. They can easily manage COVID and flu. There's no issue there, really and truly, none whatsoever. So that can be managed. No.
And similarly, and I'm so sorry we haven't been able to get to them, everyone, there's lots of questions around people's individual chronic conditions or risk factors, checking that there are guidelines that have gone out to GPs and specialists so that people can contact their healthcare providers to have those conversations.
Yeah, of course. Yep. So there's been lots of communication from the Commonwealth, and there's a really good websites there that people can access, and all the GPs have that information. So anyone who's really worried because they've got complicating factors, they'll already have a GP. I can't imagine people out there who've got anything that's so complicated that it might impact on their ability to have the vaccine or how they have it. They'll have someone that they can talk to that's managing that condition, and they need to talk to them because they are the people who will know that person best.
We hope so. So we've got about 5 more minutes for questions, but I would love, we've had a lot of people make comment in the chat about workplace program rollout. Have conversations started to happen with different industry beyond those in 1A?
No, because it'll be another 4 to 6 weeks, and it'll depend on how much Pfizer vaccine and how much AstraZeneca vaccine we've got, because I really think it would be hard to go and take Pfizer vaccine out to separate workplaces. I think that the Commonwealth is doing some very specific workplaces, but that's because those people are just so vulnerable, and there's no way we want to go and get people who are in an aged care facility to have to go to a hub somewhere. That would be a nightmare organising that to happen. Whereas for other workplaces, people are at work, they're fit and healthy. They can go to other places. They can go to GPs, to pharmacies, or to one of our mass vaccination clinics, or to one of the Commonwealth's mass vaccination clinics. So I really think that it's not necessary for us to go into the workplaces. For most workplaces, people there can manage it. I'm sure going forward it'll get sorted, but while we're just wanting to do this really big push, we'll probably be asking people to go to places to get vaccinated. It's not off the table though, so it might happen.
Dr. Young, could you speak to the creation of messaging and communications here in Queensland, and describe the work that has gone on to help put together the messages and communications around the vaccine rollout, the research that has been done into different populations and the messages that they require, particularly with consideration to diversity groups and localised messages and engagement with those different communities?
Yes. So I've been really fortunate to have some fantastic networks that I've been able to go and talk to. So the Multicultural Network, QCOS I spoke to today, you of course, and you've been so wonderful and involved in all of this. So we've really been working with an enormous range of different people, and our media and comms unit have been working with people to really try and work out what are the messages and how to get them out there, and how to make sure that we get different languages and different methods. So that's all happened. And then similarly, the Commonwealth's been doing that, and you would have already started to see their messaging coming out. So they've started to roll out their paid commercials as well. And we're starting to roll that out fairly soon. So all of that's been done at that really high level. But then we've had messaging through websites, dare I say it, through Facebook. I'm glad that our Facebook's back up again, because it's just an easier way of reaching people. It did get taken down, as did every government's Facebook for a little while, but we've got it back going again, which is really, really good. And so we've got all of that way of connecting with people. So there's a lot of different strategies we've been trying to use through different forums, different leaders, different groups to get information out there.
Thanks for that. And of course, these forums are a great way for us in a really timely way to be feeding information through to your strategic communications branch, and we look forward to continuing to do that.